My name is Amy Elder. I am an LPN to BSN student at Indiana State University, and we'll be discussing racism in healthcare. To get started, I just wanted to show a map that displayed the racial and ethnic inequities in healthcare opportunities, specifically in access to primary healthcare. It is broken down by all the different racial and ethnic groups you can see on the left-hand side there, and it shows it for all the different regions of the United States of America. And just take a moment to look at it, kind of see which ones have the biggest gaps compared to the others. After viewing this presentation, the viewer should be able to define racism, identify who is affected by racism, analyze the impact on healthcare due to racism, and recognize how to help prevent racism in healthcare. At this point, please stop here and take the pretest to assess your knowledge about racism in healthcare. The pretest can be accessed by clicking the accompanying link to this presentation. First, it's important to know what racism is. Racism is a system of structuring opportunities and assigning value based on the social interpretation of how one looks, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. Basically, it's what we do when we uh, make decisions based on how people look rather than just seeing them as a human. Who is affected by racism? A survey done of 3,453 adults that reflected on the impact of racism in healthcare on African Americans, Latinos, Asian Americans, Native Americans, and white people. It showed a lot of different things on that one other than just specifically race, but just overall um, discrimination in healthcare. And it's one of the things that shows that 45% of African Americans experience racial discrimination when trying to rent an apartment or buy a home. 18% of Asian Americans say they experience discrimination when interacting with police. Indian Americans are much more likely than Chinese Americans to report unfair police stops or treatment. And 1 in 5 Latinos have actually avoided seeking medical care due to concerns of being discriminated against or treated poorly. The graph here shows you a little bit more detail, the breakdown of the different races, and they also included men, women, and LGBTQ people as far as people who have reported the impact of discrimination before the doctor or health clinic because of their race, ethnicity, gender, or LGBTQ identity. So how has racism impacted healthcare? The U.S. healthcare system has historically engaged in systemic segregation and discrimination based on race and ethnicity. The ways that this have been done throughout our history is hospitals and clinics are once segregated for racial and ethnic minorities. And to this day, they continue to experience financial constraints, are under-resourced, and improperly staffed in those areas that were once segregated. These issues have caused inequities in the access of healthcare as well as the quality of healthcare that is provided. In order to better understand how racism impacts healthcare, it's important to understand that health disparities are symptoms of a broader underlying social and economic inequities. Research shows that conditions in which people are born, grow, live, and work and age are primary drivers of health. These factors include the social economic status, education, neighborhood and physical environment, employment, social support networks, and access to healthcare in general. This graph here kind of breaks down how underneath all of those different labels, the next thing is racism and discrimination based on different factors there for each section. In healthcare in particular, that includes health coverage, provider accessibility, provider and linguistic and cultural competency, and quality of care. But all the other factors definitely impact that as well. So what can be done to help prevent racism in healthcare? Heightened focus and understanding of the disparities can help address the problems. Some of these things need to be addressed are expanding healthcare coverage, increasing accessibility to healthcare providers, increasing access to linguistically and culturally appropriate care, and diversifying the healthcare workforce. Um, those are just specific to healthcare, the ways that we can work together as a society to help correct these racial issues and biases. Another way that we can do that is working with the social shifts in a more general sense. That would be to increase access to healthy food options, improving affordable and quality housing, enhance educational opportunities, improve physical environments, and increasing financial security and economic opportunity. If we can limit the gaps there between the racial disparities as well, it's another way that it'll improve overall community health and help. At this point, please stop here and take the post test to assess what you have learned about racism in healthcare. The post test can be accessed by clicking on the link accompanying this presentation. If you would like to print out this handout with information regarding racism in healthcare and the resources that are available, please use the accompanying link.